Bismillahirrahmanirrahim. Quote of the day: You never lose, you either win or you learn. I am Dr. Alishpa Rasool, and today I will be presenting baby friendly hospital initiatives and initiatives for neonates and infants in Pakistan and EPI under the kind supervision of Professor Dr. Saira Afzal. Learning outlines of this presentation: baby friendly hospital initiative, 10 steps of breastfeeding, benefits of baby friendly hospital initiatives for neonates and infants in Pakistan, EPI in Pakistan, recent updates, and MCQs. At the end of this presentation, participants would be able to describe the baby friendly hospital initiative and the initiatives for neonates and infants in Pakistan and the basic concept of the immunization program in Pakistan. Baby friendly hospital initiative. In 1991, WHO and UNICEF on the promotion, protection, and support of breastfeeding aims to provide health facilities with a framework for addressing practices which have a negative impact on breastfeeding. To achieve BFHI accreditation, health facilities must demonstrate a rate of at least 75% exclusive breastfeeding among mothers at discharge, adherence to the International Code of Marketing breast milk substitutes, successful implementation of the 10 steps to successful breastfeeding. The 10 steps to successful breastfeeding. Number one, hospital policies. Hospitals support mothers to breastfeed by not promoting infant formula, bottles, or making breastfeeding care standard practice. Keep track of support for breastfeeding. Staff competency. Hospitals support mothers to breastfeed by training staff on supporting mothers to breastfeed, assessing health workers' knowledge and skills. Number three is the antenatal care. Hospitals support mothers to breastfeed by discussing the importance of breastfeeding for mothers and babies, preparing mothers in how to feed their baby. Care right after birth. Hospitals support mothers to breastfeed by encouraging skin-to-skin contact between mother and baby soon after birth, helping mothers to put their baby to the breast right away. Support mothers with breastfeeding by checking positioning, attachment, and suckling, giving practical breastfeeding support, helping mothers with common breastfeeding problems. Supplementing. Hospitals support mothers to breastfeed by giving only breast milk unless there are medical reasons, prioritizing donor human milk when a supplement is needed, helping mothers who want to formula feed to do so safely. Number seven, rooming in. Hospital supports mother to breastfeed by letting mothers and babies stay together day and night, making sure that mothers of sick babies can stay near their babies. Responsive feeding. Hospitals support mothers to breastfeed by helping mothers know when their baby is hungry, not limiting breastfeeding times. Number nine, bottle teats and pacifiers. Counsel mothers on the use and risks of feeding bottle teats and pacifiers. Discharge, referring mothers to community resources for breastfeeding support. Working with communities to improve breastfeeding support services. Since BFHI began, more than 152 countries around the world have implemented the initiative. BFHI promote a multi-level, multi-sector approach which, together with the legislation regarding statutory maternity leave and protection of the breastfeeding rights of women in the workplace. Enforcement of the Code of Marketing of breast milk substitutes is essential to effectively promote, protect, and support breastfeeding. Monitoring and reassessment of BFHI facilities are important as the initiative expands. Benefits of BFHI. BFHI has been shown to be very effective in increasing breastfeeding initiation, exclusive breastfeeding, breastfeeding duration in many countries, improving mothers' healthcare experiences, reducing rates of infant abandonment. Re-evaluation of BFHI. In 2015, WHO and UNICEF began a process to re-evaluate and reinvigorate the BFHI program. An updated implementation guidance for a WHO guideline protecting, promoting, and supporting breastfeeding in facilities providing maternity and newborn services was published in 2017 based on a careful examination of evidence for each of the 10 steps. An updated implementation guidance for countries implementing the BFHI was published in 2018. Countries are called upon to fulfill 9 key responsibilities through a national BFHI program, establish or strengthen a national breastfeeding coordination body, integrate the 10 steps into relevant national policy documents and professional standards of care, ensure the competency of health professionals and managers in implementation of the 10 steps, utilize external assessment systems to regularly evaluate adherence to the 10 steps, develop and implement incentives for the compliance or sanctions for the non-compliance with the 10 steps, provide technical assistance to facilities that are making changes to adopt the 10 steps, monitor the implementation of the initiative, advocate for the BFHI to relevant audiences, identify and allocate sufficient resources to ensure the ongoing funding of the initiative. Revival of the nationwide baby-friendly hospital initiative urged. 8 August 2020, Al Khan University, Karachi. In Pakistan, breastfeeding rates are still low according to the National Nutrition Survey 2018. The proportion of children put to breast within 1 hour after delivery was 45.8%, and exclusive breastfeeding was 48.4%. Initiatives for the neonates and infants in Pakistan. Pakistan involves addressing various aspects of healthcare, nutrition, and overall well being. Here are some potential initiatives. Maternal and child health clinics. Establish and support clinics that focus on the maternal and child health, providing prenatal care, postnatal care, and vaccinations and nutritional guidance. Health education programs. Implement educational programs to raise awareness about maternal and child health, emphasizing the importance of prenatal care, breastfeeding, and early childhood development. Nutritional support programs develop initiatives that provide nutritional support for the pregnant women and infants, ensuring access to essential vitamins and nutrients crucial for the healthy development. And vaccination campaigns. Launch vaccination campaigns to ensure that infants receive timely vaccination, protecting them from preventable diseases. Community health workers train and deploy community health workers to reach remote areas, offering guidance on maternal and child health and connecting families to healthcare services. Mobile health clinics introduce mobile health clinics that can reach undeserved areas, providing medical checkups, vaccination, nutritional support for neonates and infants. Telemedicine services implement telemedicine services to facilitate remote consultations, enabling parents to seek advice on child health and receive guidance from healthcare professionals. Access to clean water and sanitation. Ensure access to the clean water and sanitation facilities, as these factors are crucial for preventing infections and promote overall health. Financial support for vulnerable families. Establish financial support programs for low-income families, ensuring they have the means to afford essential healthcare and nutrition for the neonates and infants. Capacity building for healthcare professionals. Provide training and capacity building for healthcare professionals, including doctors, nurses, and midwives, to enhance their skills in neonatal and infant care. Expanded program on immunization. The expanded program on immunization was established in 1976 to ensure that infants, children, and mothers have access to routinely recommended infant and childhood vaccines. 6 vaccine preventable diseases were initially in the EPI: tuberculosis, poliomyelitis, diphtheria, tetanus, pertussis, and measles. Purpose of EPI. Building on the momentum of the smallpox eradication effort, the expanded program on immunization was launched in 1974 to ensure that all children in all countries benefited from life-saving vaccines. EPI in Pakistan, established in 1978, the expanded program on immunization currently aims to vaccinate approximately 6 million children aged 0 to 11 months against 9 target diseases: childhood tuberculosis, poliomyelitis, diphtheria, pertussis, tetanus, hepatitis B, Haemophilus influenza type B, pneumonia, and measles. Get your child vaccinated 6 times against 10 diseases by the age of 15 months. First visit, your baby is born vaccine. Second visit, third, fourth, fifth, and sixth. This is shown. Program objectives. The objectives of EPI are to affirm the commitment of the government of Pakistan to provide safe, effective, and cost-effective vaccination against vaccine-preventable diseases. Set national standards and guidelines for the immunization aligned with the global goals and evidence-based, and encourage the generation of the local evidence for vaccination against vaccine-preventable diseases. It also aims to protect the mother and newborn against tetanus, Immunizing children with these vaccines may avert up to 17% of the childhood mortality in Pakistan. Thus, they help to contribute towards achieving the sustainable developmental goals on reducing child morbidity and mortality. Several milestones were achieved where different vaccines were added against vaccine preventable diseases. This is the whole history. Routine immunization schedule when at birth, age at birth vaccines, BCG, oral polio vaccine, hepatitis B. Second visit at 6 weeks, oral polio vaccine 1, pneumococcal 1, and rotavirus 1 and pentavalent 1. On the third visit, which is at 10 weeks, oral polio vaccine 2, pneumococcal 2, rotavirus 2, and pentavalent 2. Fourth visit, which is at 14 weeks, oral polio vaccine 3, pneumococcal 3, injectable polio vaccine, and pentavalent 3. Fifth visit at 9 months, we have to give measles 1, and sixth visit at 15 months, measles 2. Vaccine coverage, vaccinations. The percentage of the fully immunized children aged 12 to 23 months has increased markedly over a 5-year span from 54% in 2012 to 66% in 2017 to 18. Strengthening the EPI services. WHO supported the development of comprehensive multi-year plan for federal and provincial EPI programs, and based on it, the PC1 and annual plan of actions are developed. Capacity building is ongoing from mid-level managers to field staff, including vaccinators and lady health workers. Effective vaccine management is also supported by the partners. Steps are being taken to improve the data quality by the periodic data quality assessments and program reviews. Services implemented under EPI. Implementation of the expanded program and immunization encompasses procedures such as vaccinations in line with the disease control program objectives, disease surveillance, procurement of vaccine, and the supplies necessary for vaccine administration. Services implemented under EPI. The EPI primarily covers the mothers, infants, and children for immunization. The EPI program shall be including vaccines for prevention of vaccine preventable diseases among the adolescents and older age groups. Progress of Pakistan in EPI till now. With Gavi support, EPI Pakistan added important vaccine to its childhood immunization schedule, introduced new technology, expanded its cold chain capacity and other infrastructure significantly. Vaccines and EPI. The EPI also conducts supplementary immunization activities to safeguard children and pregnant mothers from vaccine preventable diseases. The program aims to immunize 3.39 million target children of 0 to 23 months annually against 12 vaccine preventable diseases. Challenges. The EPI faces several challenges in delivering routine immunization to children, including lack of clarity on whether to provide vaccination through fixed centers or mobile teams, scarcity of human resource at various levels, lack of accurate population data, on-ground logistic issues, and lack of a separate budget. Impact of EPI in Pakistan. Pakistan's expanded program and immunization performance has a significant impact on global and regional immunization indicators such as poliomyelitis eradication, maternal and neonatal tetanus, and measles elimination. Achievements of EPI, shifting of federal and provincial programs budget from development to recurrent sites, centralized procurement of vaccine and logistics in post-devolution scenario by ensuring continuous vaccine availability, introducing of 10% increase in immunization coverage gain all over the country over a period of 2 years, according to the third-party verification immunization survey, introduction of the injectable polio vaccine 2 in routine immunization as a part of endgame polio strategy, switch of pneumococcal vaccine to pneumococcal vaccine 13 and its successful implementation across Pakistan, effective and efficient distribution of more than 70 million COVID-19 vaccine doses across the country, establishment of COVID-19 monitoring cell at federal EPI, development and dissemination of CVCs and vaccine-specific guidelines and SOPs, introduction of typhoid conjugate vaccine in Sindh, Punjab, and Islamabad, refurbishment and rebranding of the health facilities and EPI fixed sites, upscaling of Sehat Tahaffuz helpline for COVID-19 vaccination to provide the information and to address the grievances, expansion of the cold chain capacity by installing 11,277 IRLs through CCEOP across the country. Distribution of 1,254 motorbikes for vaccinators in AJK, Gilgit-Baltistan, and Islam. Gavi, the Vaccine Alliance. Gavi is a public-private partnership that engages in a variety of initiatives related to immunizations, from shaping global vaccine markets to building capacity in the civil society organization for vaccination delivery. One of Gavi's major functions involves providing financial support to low and middle income countries to increase childhood immunization. Gavi eligible countries with a per capita of US dollars 115.80 or below can access funding for routine and new vaccines. One notable feature of Gavi's model is that rather than simply making grants for purchasing vaccines, Gavi typically procures vaccines on behalf of recipient countries. In Pakistan, Gavi Alliance is funding to fill the existing gaps in the health sector, including immunization, maternal and child health care, and health system strengthening. Pakistan is one of the 10 pilot countries successfully implementing this support through a consortium of 15 CSOs working in selected districts of Punjab, Sindh, Khyber Pakhtunkhwa, Balochistan, Azad Jammu Kashmir, and Gilgit-Baltistan. Since September 2009, CSOs are implementing their respective assignments and reporting to Gavi, ISCO Support Unit Pakistan. Now it's time for the recent updates. Expanded program of immunization was launched in Pakistan in 1978 to protect children by immunizing them against childhood tuberculosis, poliomyelitis, diphtheria, pertussis, tetanus, and measles. Later, with the support of development partners, a number of new vaccines, hepatitis B, Haemophilus influenza type B, and pneumococcal vaccines were introduced in 2002, 2009, 2012, and inactivated polio vaccine, respectively. It also aims to protect mothers and newborns against tetanus. Immunizing children with these vaccines may avert up to 17% of childhood mortality in Pakistan and thus help contributes towards the sustainable developmental goals. The program also plans to introduce rotavirus vaccine in 2017, which will prevent one cause of fatal diarrhea due to rotavirus. This is the expanded program of immunization, which was discussed previously in the presentation also, that at birth you have to give BCG. Implementation of the baby-friendly hospital initiative in various private and public hospitals of Pakistan. To determine the implementation of the 10 steps of the BFHI in the randomly selected public and private hospitals and clinics of Lahore. It was a cross-sectional study. Data was collected from multiple health setups. The prevalence of first two steps were filled by researchers according to their personal analysis of the staff preparedness towards the concerned matter, while the remaining 8 points were asked from mothers and filled by researchers. And the sample size was collected by Open EPI. It was 225 with a 95% confidence level. What was the result? The result was that it was observed that 60.8% of the BFHI guidelines are being observed and implemented in various hospital clinics of Lahore. The maternity care practices in hospital and clinics of Lahore are not completely being carried out according to the 10 steps of successful breastfeeding for maternal and child well-being. Lack of resources, inadequate training of health staff, and high patient load are the key hurdles in implementation of these steps. Impact of the baby-friendly hospital initiative for improving exclusive breastfeeding, a systematic review of the 10 steps to successful breastfeeding. The baby-friendly hospital initiative was launched by WHO, and it's a protective factor for health and breastfeeding promotion continues to be an important measure. Systematic review of the effect of BFHI worldwide found that BFHI was the most effective intervention for improving breastfeeding rates at health system level, and adherence to the 10-step positively effective short, medium, and long-term breastfeeding outcomes. 9 articles were included in this review. The study showed there were positive impacts in enhancement of the exclusive breastfeeding after applied baby-friendly hospital initiative program. Rates of exclusive breastfeeding were demonstrably improved by applying BFHI with 10 steps to successful breastfeeding and healthcare facilities to all the mothers from pregnancy until post-mortem. Why have immunization efforts in Pakistan failed to achieve global standards of vaccination uptake and infectious disease control? Immunization is one of the most successful public health initiatives in recent times. It is therefore worrying to learn that the level of under-vaccination in Pakistan. The reason for this variant show the uniqueness of the economic, healthcare, and environmental landscape of Pakistan, through which public health programs needs to be implemented. When compared to globally standardized targets for immunization, Pakistan is trailing behind. Not achieving these targets is worrying from both a global perspective and within the national healthcare landscape of Pakistan. Research is necessary to bring together findings on the failings of routine immunization and polio campaigns. There are many intersecting factors that global health bodies and the Department of Health in Pakistan must address in order to relieve the burden of vaccine preventable diseases. Now it's time for our MCQ session. Please all participate. A non-profit organization in Pakistan is conducting awareness campaigns to educate communities about the importance of early childhood development and proper nutrition for infants. Which initiative is the organization promoting? A. Clean Water Access Project. B. Vaccination Campaign. C. Nutrition Support Program. D. Pediatric Surgery Outreach. E. Mobile Health Clinics.
C.
C.
Yes, C is the right answer. A mother in Pakistan is concerned about her child's vaccination schedule. She wants to know how many doses of the polio vaccine are given through the EPI program. What is the correct response? A, 1 dose, B, 2 doses, C, 3 doses, D, 4, and E, 5 doses.
D, 4 doses.
Yes,
C.
yes, D is the right answer. A hospital has implemented a policy to avoid routine formula supplementation for healthy newborns. What step of the baby-friendly hospital initiative is being emphasized? A, step 2, train all health worker staff in skills necessary to implement this policy. B, step 5, show mothers how to breastfeed and how to maintain lactation. C, give infants no food, no drink other than breast milk unless medically indicated. Provide breastfeeding support and counseling. Foster the establishment of breastfeeding support programs.
C.
C.
B.
Yes, C is the right answer. A hospital is implementing the baby-friendly hospital initiative and the staff is actively promoting breastfeeding. What is the primary objective of this initiative? A, reducing hospital costs. B, enhancing pediatric surgeries. C, promoting breastfeeding and maternal-infant bonding. D, increasing the use of formula. E, expanding the neonatal intensive care.
C.
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 Yes,
C.
C is the right answer. MCQ number 5. A pregnant woman is concerned about her baby's health after birth. She asks about the vaccine her newborn will receive to prevent serious respiratory infections. What vaccine should you mention? A, mumps, B, influenza, C, pneumococcal, D, tetanus, or is it E, hepatitis A vaccine?
C.
Yes, C is the right answer. A hospital is training its healthcare staff to support breastfeeding initiation within the first hour of birth. Which step of the baby-friendly hospital initiative is being emphasized? A. Step 1, written breastfeeding policy. B. Step 2, staff training. C. Step 3, informing pregnant women about breastfeeding. D. Step 4, helping mothers initiate breastfeeding within 1 hour of birth. E. Step 5, showing mothers how to breastfeed and maintain lactation.
D.
D.
B.
Yes, D is the right answer. Helping mothers initiate breastfeeding within 1 hour of birth. MCQ number 7. A patient has been exposed to hepatitis A and needs immediate protection. Which of the following options is the most appropriate form of immunization in this case? A. Booster shot. B. Active immunization. C. Passive immunization. D. Inactivated immunization. Or is it delayed immunization? E.
Passive immunization.
Yes, C. Passive immunization is the right answer. A traveler is planning a trip to a region where specific infectious disease is prevalent. To be protected during the trip, which type of immunization should the traveler receive before departure? A. Passive immunization. B. Delayed immunization. C. Active immunization. D. Natural immunity. E. Non-specific immunization.
Active
C.
immunization.
C. Active.
Yes, C. Active is the right answer. Bacterial meningitis is a serious disease. It strikes babies more often than any other age group. Bacterial meningitis is usually more severe and may lead to long-term complications or death. Which vaccine will help prevent one previously common type of meningitis? A. Tetanus. B. Hepatitis B. C. HIV. D. Varicella. E. E. coli.
B.
Yes, B is the right answer.
B.
MCQ number 10. A hospital is evaluating its breastfeeding policies and practices to ensure compliance with the Baby Friendly Hospital Initiative. What step is being undertaken in this evaluation? A. Step 5. Show mothers how to breastfeed and maintain lactation. B. Step 6. No supplementation of breast milk unless medically indicated. Step C. Practice rooming in. D. Step 8. Provide breastfeeding support and counseling. Step 9. Evaluate breastfeeding policies and practices.
Step 9.
E.
Step 9.
E.
It's C. Step
E.
7. Practice rooming in. Step 9. C. Step 7. Practice rooming in. This is the key, and this is
That was
the
E.
This is the YouTube link of our channel. Please like, share, and subscribe to our channel where all our YouTube videos have been already uploaded. Thank you.
Thank you very much, Dr. Alishba. Very nice presentation, and the slides, they were prepared with lot of hard work. I can see. The most important points that we further elaborate in our face-to-face discussion today would be about the nature of the vaccines and how they are protecting different diseases. We know that the nature of the vaccine, that is very important to know. Killed vaccines, live attenuated vaccines, toxoids, and now we are lucky to have a messenger RNA vaccines. The RNA vaccines, they are newly used, and their side effects, they are being followed up. In EPI, we don't have any RNA vaccine till date. However, we have other vaccines, almost all the type of vaccines, including toxoids, live attenuated and killed vaccine. There are other important aspects of the vaccines that are the non-EPI vaccines. As preventive medicine is a very important component, and the vaccines and chemo prophylaxis has helped to save millions of lives around the world. So this part should also be dealt in face-to-face discussions. So we would discuss about the non-EPI vaccines, as well as the types of vaccines, nature of the vaccines, route of the vaccines, how they work, mechanism of action, their side effects, contraindication, and there is lot more to cover. So very well done, Lalishma. Thank you very much for revising the important concepts about baby-friendly initiative as well as immunization. Thank you. Allah Hafiz, and see you in face-to-face class today.
Thank you, madam.
Allah Hafiz, ma'am. Thank you.